Welcome to the Home Healthcare Today show and happy Valentine's Day to all of you out there, all the viewers as well as listeners. Today's topic is a matter of the heart, but it's veins, right? Cardiovascular Professional Week. We have the distinguished pleasure and honor of having Dr. Jeffrey H. Miller, MD, founder and CEO of Miller Vein. Prior to me introducing Dr. Miller, let's just look at a stat as related to your veins and cardiovascular health. Our hearts beat about 100,000 times a day, pumping blood throughout 60,000 miles of blood vessels, arteries, and veins. When any part of the system breaks down, your whole body feels it. This Cardiovascular Professionals Week, we're talking about the often overlooked half of that equation, your veins. Now, as for our distinguished guest, Dr. Miller was born and raised in Detroit. He earned his medical degree with high distinction, top 5% of his class, from Wayne State University School of Medicine. A BS with high honor from Michigan State University, and he is a board-certified interventional radiologist and phlebotomist, which is a vein specialist. He's a diplomate of the American Board of Radiology and National Board of Medical Examiners and the American Board of Venous and Lymphatic Medicine. He's one of Michigan's first physicians to perform minimally invasive venous treatment procedures. He left a 12-year hospital position to open up Miller Vein. Starting with one employee, now Miller Vein operates 6 locations across Metro Detroit. Locations include the city of Novi, Troy, Dearborn, St. Clair Shores, Macomb Township, and Auburn Hills, with a team of board-certified specialists. He was named to our Detroit's Top Doc multiple times. Corp Magazine's Entrepreneur of Distinction, Crane's Detroit Best Places to Work, one of those Miller Vein clinics, Detroit Free Press Top Workplaces, and 6 Detroit Free Press Best of Best Awards, including Best Vascular Vein Clinic for 2 consecutive years. He's cared for over 20,000 patients and partners with Detroit Rescue Mission Ministries for free vein clinics. Married since 2000, he's a father of 2 daughters, and he's coached their softball teams for about 7. Doc, I can go on and on about our Dr. Miller here. Softball teams for 7 years, a marathon runner who recently ran the Detroit Free Press Marathon with his daughter Rachel. Hey, Dr. Miller, welcome to the Home Health Care.
Well, thank you for having me.
All right, Doc. Born and raised in the D. All right. Educated at Michigan State in Wayne. What does it mean, man, to build a healthcare practice, 6 locations, right here at the crib, right here in your hometown?
Yeah,
Yep.
Born and raised here. I'm not going anywhere. Although I do plan on getting Miller Vein big enough that we're going to export it to other states, but no, I'm not going anywhere. My dad taught at Detroit Southwestern High School for a boatload of years.
Yeah.
Back when Coach Perry Watson, I don't know if you remember him.
Okay, yeah.
I actually even shot free throws with Antoine Jobert.
No way.
So anyway, my roots are here. I'm staying here. I love it. I love everything. I love the people, but I will say I don't necessarily love the winter.
I get it, man. So you can trust Dr. Jeffrey Miller here in our conversation, folks. So on a more serious note, now that we got our background out of the way here with Dr. Miller, the hidden epidemic, and as we talk about veins and vein health. So varicose veins and spider veins, most folks kind of think it's a cosmetic thing, right? Doc, let's dig a little bit deeper. You treat it as a medical condition. How can our viewers and our listeners understand venous insufficiency and what's really going on, and why does it matter to your overall health?
You know what I love to say is leg pains, think veins. Because leg pains, think veins.
Okay.
And that's because vein disease is such a common cause of all kinds of symptoms. Now, the most common symptoms, a company actually trademarked the symptoms, if you can believe that, but I digress.
Uh-oh. Yeah, sure,
They're
sure.
called the hasty symptoms: heaviness, aching, swelling, throbbing, and itching. Those are the most common cause of chronic vein disease. It's also a really common cause of restless leg syndrome.
Yes,
But it's
yes.
a treatable cause. And so I always tell patients or physicians or anybody that'll listen to me, you know, if you have restless leg syndrome, before you go on those medications that can have some complications, get a vein workup, because it is common enough and it's a treatable condition.
Wow, Doc. So let's go over hasty. Let's go over it one more time there. Heaviness of the legs, right? Aching,
Yeah.
swelling. What's the T for?
Throbbing.
Throbbing. Not tingling, but throbbing.
Throbbing.
Very good. And then the eye itching.
Important thing to keep in mind,
Yes.
vein disease untreated
Yeah.
will go on to skin changes where the skin becomes brown and leathery.
Yep. Absolutely.
And
We've
then
seen it. Yes.
further down the line, a leg ulcer, and those hurt.
Yes, sir.
So
Yes,
again,
sir.
we can prevent people from going that far down the road.
Absolutely, Doc. So yeah, it's about prevention. The Home Health Care Today show, we're a lifestyle show. The more that we could create that sense of knowledge and education around various diagnoses, the better. With that being said, Doc, who's at risk or who's at greater risk?
4 big risk factors.
Okay, let's do it. Yep.
Okay. Number 1, heredity. We know it runs in families. If both parents are affected, you're talking 90% chance their kids are going to have varicose veins.
Heredity, yes.
Age. We were just talking about aging a second ago.
A little bit, yeah, we were.
You know, as we age, things get weak, including our veins. And our veins have these little one-way valves. When
Yes.
the vein becomes weak, the valves don't work. And veins are supposed to carry blood upward.
Yes, sir.
If they're not carrying blood upward, blood refluxes, pools in the leg, and that's another common cause. Being female is a risk, and then pregnancy is a huge risk. Each subsequent pregnancy increases the risk further.
Wow, Doc. Wow, okay. 4 factors, some of which are mitigable to an extent. We all have to age, right? Heredity, maybe not as mitigable there. As we talk about the blood flow, which is extremely important, and then you talk about pregnancy as one of those factors. But let's drive back to the cardiovascular connection, where we understand anatomy to an extent, but for listeners and viewers out there that are like, all right, I got the whole arteries versus veins, from a physiology class, and some did not have physiology. So let's make that's a class that if you could waive it, students out there, don't waive the cardiovascular classes as related to anatomy and physiology. Dive in. We need a healthy staff of cardiovascular professionals out there for the future. But Doc, what is that connection? Cardiovascular connection. Let's do it.
I like to put it together as, okay, obviously the heart's at the center.
Yes, it is. Yep.
And then we've got to consider 4 other things that are very interrelated. Arteries are going to carry blood to your extremities, to the organs, need those. Yep. Veins are going to carry blood back from the extremities, back from the organs, back to the heart. But then there's 2 things that are also in that mix. It's all one big system, which would be skin and the lymphatics.
Yes.
So what do the lymphatics do? They're these tiny tubes that carry fluid from our extremities and dump the fluid into the veins. If the veins are messed up, the lymphatics are messed up.
Got it.
And then what about skin? Well, if the fluid builds up under the skin,
Doc.
Skin doesn't get the oxygen and nutrients it needs.
Yeah.
It breaks down, and then you get an ulcer.
Got it, Doc. So we're going to keep it moving. We're going to try to keep our viewers, our listeners, as active as they can be, and we dive deeper into this vein health, right? I got a home health community out there. I got some folks that are more sedentary due to other diagnoses, right? We have some folks that unfortunately have limited mobility. how can we, assist this group that says, Doc, it all sounds good, but I got chronic pain, arthritis. I can't move as much. What can we do and how can we help those folks?
Some of them can't get up and walk at all, but if you can get up and walk, walk. Any movement's going to help. Even if you're sitting, pump your foot back and forth. Get your calf muscles pumping.
Yeah.
The calf muscles are actually responsible for getting more blood out of your legs than any other muscle. We've got these big thigh muscles.
True. Yep.
Those don't squeeze the blood out. It's the calf muscles, because all those veins interdigitate between all the muscle fibers. So when you squeeze that calf muscle, you're going to get fluid. You're going to get blood out of the legs. So that's really important. Everybody knows we got to eat right.
You got to do it, man.
Because obesity also is a risk factor for vein disease. Obesity makes everything worse. So, the better you can eat, the more you can move. Those are the big two.
Oh, got it, Doc. So better eating, better movement out there, folks. Restless legs. We hear about that a lot. So, going to check on folks and they're just heavy and I don't know what's going on. And Doc, we don't do medical advice on our show. We always recommend individuals that are suffering from any health complication to reach out to your primary care physician. If it is indeed an emergency, always call 911. And if there's an injury, be sure to get to an urgent care facility in the event that there is an injury that doesn't require going to the ER. But for folks just general living and say, man, my legs are restless. Not watching the Home Healthcare Today show because you're bouncing your legs in place watching the show if you can. But for restless legs, Doc, movement, diet, good exercise, what else can we do about it?
Well, then you got to get into the doctor, because we do a duplex venous ultrasound.
Got it.
And that tells us, are the veins working?
Yes.
That identifies leaky valves. So if a patient has restless leg syndrome and has venous reflux, I will tell you that 70 to 80% of those patients, if they get treatment, will feel better.
Absolutely.
And if they were on medications for restless legs, they might be able to completely stop taking them.
Okay, now you all heard that now. In the event that legs are restless, getting in to physician, getting in to see Dr. Miller at one of the 6 locations to get that assessment, and not just say, well, I guess it'll go away on its own. Oh, I think it's sciatica, or I think it's arthritis. You don't have to necessarily self-diagnose. Trained experts and professionals who care deeply about your cardiovascular health and wellness are ready to assist. We're headed to a commercial. When we get back, we're going to dive deeper into not only vein health, but we'll learn a lot more about Dr. Miller and his passion for this work in our community. Stay tuned. We're bringing a new show called the Home Healthcare Today Show, hosted by Dr. Cleamon Moorer and sponsored by Meridian Health Plan in Michigan. On a weekly basis, we bring in Michigan's top health experts to dive into a variety of health and wellness topics. Content ranging from, how do I manage a health complication or an issue? How do I live a healthier lifestyle? Tune in every Saturday morning, 10 a.m.
Hi there, I'm Jeffrey Miller, Dr. Miller, the Miller of Miller Vein. One thing that people don't realize is that patients that have varicose veins actually have quality of life scores that are similar to patients that have had prior heart attacks, prior stroke, prior hip fracture. Of course, I'm not saying that varicose veins are an emergency, but I am saying that varicose veins really cause a ton of symptoms. So if you have leg pains, think veins.
Welcome back to the Home Healthcare Today show. Yes, it's Cardiovascular Professionals Week, and we have none other than Dr. Jeffrey Miller of Miller Vein. We got off into some really good topics in the first half of our episode, but now we're back at it. I want to dive a little deeper here and talk about Dr. Miller from the perspective of being an innovator as well as an entrepreneur and being very compassionate about care. So, Doc, working in the hospital for about 12 years and then saying, you know what, I'm going to make the leap and run my own practice, starting with one employee, the solopreneur. And let's talk about that. What drove you to make that leap and say, I'm gonna do this?
You know, for me, every step in my journey I feel like it's always just presented itself to me. It was all
Yes.
by accident.
Uh-huh.
1999, the
Yeah.
very first device gets FDA approval
Uh-huh.
to treat the underlying cause of varicose veins.
Yeah.
So
Which
we
is?
start,
I'm sorry.
it's
Which
called,
is?
it was called radiofrequency ablation. It was
Yes,
the
sir.
venous closure device.
Got it. Okay. Yes.
Now you got to understand,
Yeah.
my interventional team and I, we would always ask for great equipment,
Yeah.
but the equipment that we would ask for was expensive. But we asked them for this radio frequency device, and the fact that it was only $30,000, which to them is nothing when you're asking for multi-million-dollar pieces of equipment, they got us the piece of equipment.
There we go.
So we started treating veins. The first generation of device was kind of clunky. I had 4 other colleagues that were interventional radiologists, so there's 5 of us. That clunky device, nobody liked it.
Nope.
They were upset. They didn't like doing
They
those
didn't like
procedures.
it.
So because of that,
Yep.
I guess I'm pretty patient. I didn't mind it.
Sure.
And so I started doing all the vein patients, all of them. And then the next thing you know, the devices got better. Well, by that time, I'm the vein guy. So I keep doing veins. I'm enjoying it. I didn't have to be as smart as you to realize that this didn't belong in the hospital setting.
Sure.
You know, we had patients that were coming in for these elective procedures,
Right. Right.
and they're waiting 2-3 hours because we're doing emergency cases that are bumping the elective cases.
Got it. Uh-huh.
So I was in a very large radiology group, worked with a lot of great people that I loved,
Yes.
but they didn't see things the same way as I did. I really wanted them to help me, and we were going to open up a vein clinic across the street. We would see all our patients, blah, blah, blah.
Uh-huh.
And after trying to convince my group for like 5 years to do this, well, my wife got sick and tired of me complaining, and she says, why don't you just do it yourself? So I quit, and I did it myself, and here we are, almost 20 years later.
Love it. I love it, Dr. Miller. So, Dr. Miller, as you all can tell from that feedback there, that response showed that he's an innovator and a risk taker, right? As well as a clinician. So he's a medical doctor that has taken innovation and business to that next level. Dr. Miller and I, we're also we were noted in Crane's Detroit Business Notable Leaders in Healthcare Technology 2025 for the work that we're doing out here in the world, right? Similar to that clunky equipment in the vein area, we understand going to an eye doctor could be a very clunky experience. So our sponsor of the show, Meridian Health Plan, backed my vision of creating mobile eye care units to bring accessible eye care to homebound Detroiters and Michigan residents. Doc, we're merged there. What have you seen in the evolution of equipment? Because being a kid going to the eye doctor, I've seen a lot of changes in equipment from what I got in my van versus what was in the clinic back in late 70s. I won't date myself that much. What have you seen in terms of the evolution of equipment?
Oh, it's crazy. I mean, I told you the first device we used was clunky.
Right.
Now we've got these heat catheters that, we heat up a segment of vein, 20 seconds, pull it back, repeat really quick.
So kind of non-invasive.
Non-invasive in office. Okay. We can inject foam medication into the veins to close them down really quick.
Yes.
We take advantage of medical adhesives now. So we got this really slick catheter. We put the catheter where we want it. It's got a little dispensary gun. We deliver just the right amount of medical adhesive at each segment of vein, close them right down.
Yeah.
Procedures today we're talking anywhere between 5 to 15 minutes.
Yeah.
Yesteryear, it was hospitalization and stripping, big incisions, a lot of recovery. Now you're up and walking immediately.
I love it. I love to hear that, Doc. I love the focus on the innovation, the entrepreneurship. In the first half, we talked about some of those warning signs for folks to really watch out for when to go and get to the doctor. I got some folks out there in the listener and viewer audience that say, oh man, doctors are just always trying to do things to me. They just want to run tests. They just want to do all these different unnecessary things. But we understand that healthcare is a necessity. Your focus has been purpose and it's been people, fueled by your passion to change folks' lives and change their health conditions over profit. Let's talk about that. 6 clinics and saying, but I'm putting people over the dollar. Let's go there.
Yeah, I actually believe most of us human beings
Yeah.
just want to help other people. And I think most people understand that when you help other people,
Yeah.
it's almost like a selfish thing. It makes you feel great. I mean, it's such a motivator.
It is. Yep. Yep.
And I do see, I think it's a minority of docs out there that
Yep.
are doing the profit over the
Sure.
patient.
Sure.
But I'll see these patients that come in
Yeah.
and they had a procedure that I know they didn't need. And they're left with metallic stents inside their body that are going to be there forever. And it didn't even treat the underlying problem that they have.
Yeah. Yeah.
That drives me nuts.
Yeah.
And I just can't stand that. And
No.
I will tell you, everybody that works at Miller Vane, I mean, they know like that we put our patients first. And I think that makes a huge difference.
And that leads me to the next question, Dr. Miller. Building that dream team. Building a team of not only clinical specialists and experts, but folks that share that same passion for humanity and purpose and improving others' lives. How do you do it nowadays? How do you build and maintain and sustain the dream team? Because I've seen a lot of the videos on YouTube from the Miller Vane clinics. You guys are having a really good time, man. Like, so what's going on with the team? How you do that, bro?
I'm going to say something that's going to sound a little bit counterintuitive, but you've heard, especially since with your business background, put the customer first, right? Customer always comes first, and the customer is always right. So we can make the analogy: patient is always right, patient first. You know what? It comes to putting the employee first. If your employees are really happy, guess what?
They're going to make those patients happy. They're going to work
right.
harder.
And that's
Absolutely.
really what we focus on. And we do everything in our power to make sure our employees are empowered to do the right thing.
Amen.
They love that.
Yeah.
They hang out after hours because they're like little families, but functional families, families that get along. I mean, that's important. And we just try to connect. We have a lot of meetings so that everybody's voice can get heard. We try to throw at least 2 parties a year, a winter one and a summer one. Get everybody together and just we enjoy each other's company. And that makes a huge difference in patient care. Happy people do a better job taking care of patients.
That's right, Doc. That's right. I love it. I love it. I do. So Detroit Rescue Mission Ministries, very familiar with the men's shelter facility. Have volunteered and spent some time there, right? Talk to me about some of your work and giving back in the community, man.
Yeah, so we try to do as much as we can. So we're a partner with DRMM. We've set up free vein clinics. We're going to do one in the near future. Love doing that. I will tell you, our big thing is we've partnered with Southeast Michigan Assistance League.
Okay.
They have this thing called Operation School Bell, where basically we go into a school, we use the gym and set up a store. And kids come in, and then once we set up the store, we take the kids shopping. And of course, they don't pay for anything. I will tell you that my staff look forward to that day every year more than any of the parties that we throw, because these kids, they're first off, they appreciate everything. They're so and they have nothing. I've seen kids where it's their first winter coat. Michigan isn't a warm place to have no winter coat. Kids saying, "Oh, it's my first toothbrush," and things like that. So the teams love it. I think, like I said, I think most humans just love to help other people, and we come out of that, we just feel very humbled and very energized because we feel like we made a little difference.
And that's purpose. As you think about positive psychology, and the positive psychologists say that that sprint or that pursuit of pleasure is fleeting when it comes to happiness. Trying to stay in a flow and keep the dream team happy all the time in the middle section, that's sometimes hard with happiness. But the top layer of happiness, the fulfillment of purpose. So that giving back that paying it forward. Thanks for embodying that, Dr. Miller, and exemplifying it. All right, running out of time on the Home Healthcare Today show for this episode. So let's end with the marathon mindset. So, we're talking about those legs, man. Spring is around the corner. What's up? Talk to me about this marathon mindset that you take on professionally, and as well as personally, running with your daughter and all. Let's go there. And the challenge that you have for me over here. Let's do this,
well,
man.
I will tell you, truth be told, I don't even identify as a runner.
I don't know about that, man.
I don't love running, although I enjoy it afterwards.
I see the calves. Going back to calf health, I'm seeing the calves. Yep.
But having said that, I will tell you, I love setting goals that seem impossible.
Yes, sir, Doc.
Because once you've set it, then you literally have to work backwards and say, well, okay, how do I do that?
That's us, 40,000 homebounders.
I was telling you. You've got to sign up for the full marathon.
That part, man.
And then you can figure out how to do it, even if right now you're not running today.
I'm going to sign my name, Jeffrey H. Miller.
Well, then there'll be two Jeffrey H. Millers because I signed up this year. And I've got both my daughters running this year.
All right. No, I won't sign up as Dr. Miller. I will sign up as Dr. Cleamon Moorer, host of the Home Healthcare Today show. I'll do it. I'll take that challenge on. Dr. Miller, this has been an honor, man, and a pleasure to have you on the show.
Pleasure's mine.
And got to have you back for more topics, man, because you're way more than just Cardiovascular Professionals Week, but happy Cardiovascular Professionals Week to you and your dream team at Miller Vane.
Thank you. To you as well.
Thank you, brother. We went from podcast to broadcast. The Home Healthcare Today show is back. I'm your host, Dr. Cleamon Moorer. The show is sponsored by Meridian Health Plan in Michigan. Stay tuned.
And about 10% of them were living much longer than expected. And we presented this data to the FDA, made substantial discoveries in the lab, finding which receptor on tumor cells sense these frequencies and what pathway activated. And in 2023, the FDA gave us approval for this device, which is now available to all patients with advanced liver cancer in the US.